West Nile virus can cause a fatal neurological disease in humans. However, approximately 80% of people who are infected will not show any symptoms. West Nile virus is mainly transmitted to people through the bites of infected mosquitoes. The virus can cause severe disease and death in horses. Vaccines are available for use in horses, but not yet available for people. Birds are the natural hosts of West Nile virus. West Nile virus WNV can cause neurological disease and death in people. WNV is commonly found in Africa, Europe, the Middle East, North America, and West Asia. WNV is maintained in nature in a cycle involving transmission between birds and mosquitoes. Humans, horses, and other mammals can be infected. West Nile virus WNV is a member of the flavivirus genus and belongs to the Japanese encephalitis antigenic complex of the family Flaviviridae. West Nile virus WNV was first isolated in a woman in the West Nile district of Uganda in 1937. It was identified in birds, crows, and columbiforms in Nile Delta region in 1953. Before 1997, WNV was not considered pathogenic for birds, but at that time in Israel a more virulent strain caused the death of different bird species presenting signs of encephalitis and paralysis. Human infections attributable to WNV have been reported in many countries in the world for over 50 years. In 1999, a WNV circulating in Israel and Tunisia was imported in New York, producing a large and dramatic outbreak that spread throughout the continental United States of America, USA, in the following years. The WNV outbreak in USA 1999-2010 highlighted that importation and establishment of vector-borne pathogens outside their current habitat represent a serious danger to the world. The largest outbreaks occurred in Greece, Israel, Romania, Russia, and USA. Outbreak sites are on major birds' migratory routes. In its original range, WNV was prevalent throughout Africa, parts of Europe, Middle East, West Asia, and Australia. Since its introduction in 1999 into USA, the virus has spread and is now widely established from Canada to Venezuela. Human infection is most often the result of bites from infected mosquitoes. Mosquitoes become infected when they feed on infected birds, which circulate the virus in their blood for a few days. The virus eventually gets into the mosquito's salivary glands. During later blood meals when mosquitoes bite, the virus may be injected into humans and animals, where it can multiply and possibly cause illness. The virus may also be transmitted through contact with other infected animals, their blood, or other tissues. A very small proportion of human infections have occurred through organ transplant, blood transfusions, and breast milk. There is one reported case of transplacental mother-to-child WNV transmission. To date, no human-to-human transmission of WNV through casual contact has been documented, and no transmission of WNV to healthcare workers has been reported when standard infection control precautions have been put in place. Signs and symptoms: infection with WNV is either asymptomatic, no symptoms in around 80% of infected people, or can lead to West Nile fever or severe West Nile disease. About 20% of people who become infected with WNV will develop West Nile fever. Symptoms include fever, headache, tiredness, and body aches, nausea, vomiting, occasionally with a skin rash on the trunk of the body and swollen lymph glands. The symptoms of severe disease, also called neuroinvasive disease, such as West Nile encephalitis or meningitis or West Nile poliomyelitis, include headache, high fever, neck stiffness, stupor, disorientation, coma, tremors, convulsions, muscle weakness, and paralysis. It is estimated that approximately 1 in 150 persons infected with the West Nile virus will develop a more severe form of disease. Serious illness can occur in people of any age. However, people over the age of 50 and some immunocompromised persons, for example, transplant patients, are at the highest risk for getting severely ill when infected with WNV. The incubation period is usually 3 to 14 days. West Nile virus can be diagnosed by a number of different tests, IgG antibody seroconversion or significant increase in antibody titers into serial specimen collected at a 1-week interval by enzyme-linked immunosorbent assay ELISA. IgM antibody capture enzyme-linked immunosorbent assay ELISA. Neutralization assays. Viral detection by reverse transcription polymerase chain reaction RT-PCR assay. In virus isolation by cell culture, IgM can be detected in nearly all cerebrospinal fluid (CSF) and serum specimens received from WNV-infected patients at the time of their clinical presentation. Serum IgM antibody may persist for more than a year. Treatment and vaccine. Treatment is supportive for patients with neuroinvasive West Nile virus, often involving hospitalization, intravenous fluids, respiratory support, and prevention of secondary infections. No vaccine is available for humans. Vector and animal hosts. WN virus is maintained in nature in a mosquito-bird mosquito transmission cycle. Mosquitoes of the genus Culex are generally considered the principal vectors of WNV, in particular CX, pipiens. WNV is maintained in mosquito populations through vertical transmission adults to eggs. Birds are the reservoir hosts of WNV. In Europe, Africa, Middle East, and Asia, mortality in birds associated with WNV infection is rare. In striking contrast, the virus is highly pathogenic for birds in the Americas. Members of the crow family Corvidae are particularly susceptible, but virus has been detected in dead and dying birds of more than 250 species. Birds can be infected by a variety of routes other than mosquito bites, and different species may have different potential for maintaining the transmission cycle. Horses, just like humans, are dead-end hosts, meaning that while they become infected, they do not spread the infection. Symptomatic infections in horses are also rare and generally mild, but can cause neurologic disease, including fatal encephalomyelitis. Preventing transmission in horses. Since WNV outbreaks in animals precede human cases, the establishment of an active animal health surveillance system to detect new cases in birds and horses is essential in providing early warning for veterinary and human public health authorities. In the Americas, it is important to help the community by reporting dead birds to local authorities, reducing the risk of infection in people. In the absence of a vaccine, the only way to reduce infection in people is by raising awareness of the risk factors and educating people about the measures they can take to reduce exposure to the virus. Public health educational messages should focus on the following: reducing the risk of mosquito transmission. Efforts to prevent transmission should first focus on personal and community protection against mosquito bites through the use of mosquito nets, personal insect repellent, by wearing light-colored clothing, long-sleeved shirts and trousers, and by avoiding outdoor activity at peak biting times. In addition, community programs should encourage communities to destroy mosquito breeding sites in residential areas, reducing the risk of animal-to-human transmission. Gloves and other protective clothing should be worn while handling sick animals or their tissues, and during slaughtering and culling procedures. Reducing the risk of transmission through blood transfusion and organ transplant. Blood and organ donation restrictions and laboratory testing should be considered at the time of the outbreak in the affected areas after assessing the local or regional epidemiological situation. Effective prevention of human WNV infections depends on the development of comprehensive, integrated mosquito surveillance and control programs in areas where the virus occurs. Studies should identify local mosquito species that play a role in WNV transmission, including those that might serve as a bridge from birds to human beings. Emphasis should be on integrated control measures including source reduction with community participation, water management, chemicals, and biological control methods. Preventing infection in healthcare settings. Healthcare workers caring for patients with suspected or confirmed WNV infection, or handling specimens from them, should implement standard infection control precautions. Samples taken from people and animals with suspected WNV infection should be handled by trained staff working in suitably equipped laboratories. For those unfamiliar, the virus is transmitted through mosquitoes and is most active this time of year. We tend to see rises in it in late summer, especially in August and September. Most people that get the virus are not going to have any symptoms at all. Dr. Dumford said if a person were to experience symptoms, they would typically include fever, muscle aches, and sometimes nausea. In rare complications, they could also develop West Nile neuroinvasive disease. There is no specific treatment for West Nile virus. However, supportive care is often used, like getting rest, staying hydrated, and taking over-the-counter pain relievers. One thing to do to prevent West Nile virus and other mosquito-borne illnesses is to try to avoid mosquito bites altogether. If we're talking specifically about West Nile virus, it's transmitted by a mosquito that typically is active at those twilight and nighttime hours. So it's a good idea, not just at those times, but all throughout the day. If you're going to be outside, apply an EPA-approved mosquito repellent. If a person gets it, they cannot spread it to some. Simple mosquito treatment with insecticides which are not at all selective is the worst solution and the greatest cause of worsening future ecological conditions and, therefore, the virulence of future diseases. Thank you so much for watching today's video. If you found it helpful, don't forget to like, share, and subscribe to our channel for more valuable content. Your support truly motivates us to keep creating better videos. See you in the next one.